All right. Good afternoon, everyone. Thank you for your patience and thank you for joining us for the Dental Board of California Quarterly Board Meeting. My name is Joanne Pacheco and I'm the president of the board. Today is Thursday, August the 19th, 2021. The board is being held via WebEx. Pursuant to the provisions of Governor Newsom's Executive Order N-08-21 dated June 11, 2021, neither a public location nor teleconference locations are provided for this meeting. For all those who wish to participate, please log on to the WebEx website provided on the posted agenda for this meeting. Instructions to connect to the meeting are provided on the agenda. The preferred audio connection is via telephone conference and not the microphone and speakers on your computer. The phone number and access code will be provided as part of your connection to the meeting. Since this meeting is being conducted via WebEx, I will ask all board members and speakers to announce themselves by name before speaking for clarity of the official record. All board members are able to unmute themselves to speak during the meeting. Please place yourself back on mute when not speaking to reduce noise for all participants. When making a motion, please use the raised hand feature, and I believe that this location is at the bottom right of the WebEx screen, so board staff can identify a motion and a second. During a discussion on an agenda item, please use the raised hand feature if you want to speak, and I will call on you. Following such online meeting etiquette will ensure the best audio quality for everyone. During each call for comments from board members and speakers, we will ensure that all comments can be accommodated and are heard before proceeding with the next agenda item. This is an official business meeting of the Dental Board of California. The board welcomes public comments on any item on the agenda, and it is the board's intent to ask for public comments prior to the board taking action on any agenda item. The Dca Moderator will explain the process for providing public comment shortly. When called upon, the moderator will unmute the microphone of the individual and they will have 2 minutes to make public comment. The moderator will audibly announce when 30 seconds remain to conclude public comment. After the 2 minutes have lapsed, the individual will be placed back on mute. Only one public comment per agenda item is allowed per attendee. Depending on the number of people who would like to testify on a particular agenda item, a total time limit may be imposed. We ask all speakers to please stay on topic and not repeat testimony already provided. If you agree with testimony already provided, please just state your name and that you are in support of any comments previously provided. I would now like to ask the Dca Moderator to please explain how public comments will be taken during this WebEx meeting.
Thank you. This is the moderator. For today's meeting, we will be utilizing the WebEx question and answer feature. You will hear me refer to this as the Q&A. When the board reaches a point in the agenda at which public comment is appropriate, the question and answer feature will be turned on and members of the public can indicate that they would like to make a comment by clicking on the Q&A icon on your screen, which looks like a question mark inside of a square. That will open a text box, and in that text box you can type comment or I would like to make a comment and submit that to the host. We will be taking comments in the order that they were received. I will call on the individual by the name that they have logged in with and send them a request to unmute their microphone. In this new WebEx platform, when I click on your microphone, it will prompt you at your end with a pop-up box to unmute your own microphone, and you can do that by clicking on the Unmute Me button that will appear. As the president stated, everyone will have 2 minutes to make their comments with a 30-second reminder. At the conclusion of the 2 minutes, your microphone will be muted, and I will move on to the next member of the public who is requested to comment. Please note that the Q&A feature is being used only as a means for members of the public to represent that they would like to make a verbal comment. This is not a means to ask questions of myself or members of the board. Such inquiries submitted using this feature will not be answered. When making your comment, please make sure the comment is directed at the host in the dropdown. While you are free to express criticism or negative views for the sake of the members of the public participating on the call, please do not use profane language when making public comments to the board. I will provide a brief reminder of this approach at the start of the public comment sections. And finally, when board members or senior staff are not speaking, I would like to remind them to mute their microphones. If I do detect background noise during the meeting as a result of unmuted microphones, I will either interject with a brief friendly reminder, or I may mute your microphone myself if it is not an appropriate time to interrupt the meeting flow. I also wanted to touch on a couple of the new features in this new WebEx environment. One of them is the fact that I cannot unmute your microphone. Instead, I send you a request to unmute your microphone yourself. That is for our attendees. For our panelists, you still have the ability to unmute your own microphones. For our hand raise feature today, our hand raise icon has moved. If you hover your mouse over your own name, you will notice a hand icon to the right of your name. That is your hand button to raise your hand. So if you click that icon, it will raise your hand. Clicking it again will lower your hand. And last but not least, as you may have noticed, we now have live closed captioning. Somewhere on your screen, typically at the bottom, you will see a small window that is basically translating everything that we say. If you would like to see this, you can leave it on your screen. I believe in most cases, you could click on it, drag it around your screen if you'd like to put it in a different location. If you would not like to see this and you would like to hide it, at the bottom left of your screen, and that's for most people, you should find two icons. One looks like a little robot and one is a closed captioning icon. If you click on that closed captioning icon, that should hide the closed caption display on your screen. You can simply follow that same procedure to make it reappear on your screen. We also have a feature where you can watch the transcript by speaker. And if you would like to access that, you can click on the robot icon and select view captions and highlights. And again, to disable that, you would follow those same steps. And with that, I'll turn the floor back over to President Pacheco.
Thank you. I would like to call the meeting to order and ask the board secretary to please call the roll.
Good afternoon. This is Dr. Alan Felsenfeld, board secretary, and I will now call the roll. Burton.
Burton, aye.
Burton
here.
Present. Thank you. Burton present. Chan.
Chan present.
Chan present. Felsenfeld present. Larine.
Lorraine present.
Larine present. Mackenzie.
Here.
Mackenzie present. Medina.
Medina present.
Medina present. Mendoza.
Present.
Mendoza present. Molina.
Molina present.
Molina present. Montel.
Montel present.
Montel present. Morrow.
Morrow present.
Morrow present. Olagi.
Olagi present.
Olagi present. Pacheco.
Pacheco present.
Pacheco present. Stewart.
Stewart present.
Stewart present. You.
You present.
You present. Madam President, we have a quorum.
And thank you, board secretary. We will now move on to agenda item 2, public comments not on the agenda. Are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We have opened the Q&A panel. If you'd like to request to make a comment for items not on today's agenda, please click on the Q&A icon on your screen, type comment into the text box, and submit that to the host. And seeing no requests, would you like me to close the panel?
Yes, please, and thank you.
It is closed.
We will now move on to agenda item 3, discussion and possible action on May 13, 2021, May 14, 2021, and June 14, 2021 board meeting minutes. Are there any board member discussions? Please use the raised hand feature. Seeing none, is there a motion and a second? Use the raised hand feature, Dr. Morrow and Ms. Burton. And thank you. Please turn off the raised hand feature. I see Dr. Chan. Did you have a question, Dr. Chan?
Seconding.
Oh, you're seconding. Okay, we had Dr. Morrow and Ms. Burton.
I'm sorry to interrupt, President Pacheco, but we need to have them verbally motion and second.
Okay,
This is Morrow. I move to accept the minutes of the board meetings, May 13 and 14 as presented.
Burton, second.
May we also include June 14th in that?
Yes.
thank you. So the motion was to accept the minutes as written for the dates provided. And thank you. And please lower your raised hands. Are there any public comments? Dca Moderator, please facilitate the lines for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to make a comment on the motion presented, please click on the Q&A icon on your screen, type comment into the text field, and submit that to the host. And while we wait, Dr. Chan, did you have a question?
I have a question. I'm not sure about removing the hand.
If you click on it, just like you did to raise it, it will lower it. There you go.
Okay.
And seeing no requests for comment, would you like me to close the panel?
And yes, please. Thank you.
It is closed.
Board Secretary, please call the roll and record the votes for this agenda item.
Okay, the motion is to approve the minutes of the May 13th, 14th, and June 14th meeting of the Dental Board. Burton.
Burton, aye.
Burton, aye. Chan.
Chan, aye.
Chan, aye. Felsenfeld, aye. Loreen.
Loreen, aye.
Loreen, aye. Mackenzie.
Mackenzie, yes.
Mackenzie, aye. Medina.
Medina, aye.
Medina, aye. Mendoza.
Aye.
Mendoza, aye. Excuse me. Molina.
Molina, aye.
Molina, aye. Montel.
Montel, I.
Montel, aye. Morrow.
Morrow, aye.
Morrow, aye. Olagi.
Olagi, aye.
Olagi, aye. Pacheco.
Pacheco, aye.
Pacheco, aye. Stewart.
Stewart, aye.
Stewart, aye. You.
You, aye.
You, aye. The vote is unanimous. The motion is adopted.
And thank you, Board Secretary. We'll now move on to agenda item 4, Board President Report. So again, good afternoon, everyone. And as I prepared my report for today, I reflected on how much I do miss seeing all of you in person. And I look forward to when we meet again. I would like to thank the board's executive officer and all of the board staff for their efforts in maintaining business as usual during these continued unusual times. And of course, for their assistance with all of our technology today. I applaud all healthcare providers and their diligence in practicing safely during the continued pandemic. And times are looking brighter with vaccination initiatives, busy practices, and an in-person fall convention. In carrying out my duties as board president, I continue to meet with the executive officer on a weekly basis to discuss the Dental Board of California business, as well as attend the DCA Board and Bureau Brown Bag Series as appropriate. As we move through our agenda over the next 2 days, let us be reminded that the members of the Dental Board, individually and collectively, are dedicated to the legislative mandate that protection of the public shall be at its highest priority. Whenever the protection of the public is inconsistent with other interests sought to be promoted, the protection of the public will always be paramount. This concludes my report, and we will now move on. Are there any board member comments? Please use the raised hand feature. Seeing none, are there any public comments? DCA Moderator, please facilitate the lines for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to make a comment on this report, please click on the Q&A icon on your screen, type comment into the text box, and submit that to the host. And seeing no requests, would you like me to close the panel?
And yes, please. Thank you. We will
You're
now
welcome.
move on to agenda item 5, Executive Officer's Report.
Thank you, President Pacheco. My name is Karen Fisher, and I'm the Executive Officer of the Dental Board of California. And I don't know how long my voice is going to last because we have a lot of smoke here in Sacramento, and we've had a lot of smoke for the last couple of days, so please bear with me. I'm going to start out by giving the personnel report and the staffing as of Monday, August 16th of this week. The current vacancy rate for the board is about 20% based on 84 authorized positions. The vacancies can be attributed to new authorized positions not yet filled, retirements, transfers to other departments, and promotional opportunities. At present, the executive management team is fully staffed. Administrative Services Unit has 2 vacancies, and they're critical vacancies, in that one is a budget analyst and the other is our ledge-reg analyst. The Anesthesia Unit has 2 vacancies. The Licensing and Examination Unit has 3 vacancies. The Dental Assisting Unit has 4 vacancies. The Investigative Analysis Unit has 1 vacancy. The Complaint and Compliance Unit has 1 vacancy. The Discipline Coordination Unit is fully staffed. The Sacramento Field Office has 1 vacancy. The Dental Consultant is fully staffed. And the Orange Field Office has 3 vacancies. Staff have been aggressively recruiting and interviewing candidates to fill these vacancies and is offering in-person and telephone interviews as optional interviewing methods. Should current recruitment efforts be successful, it is anticipated that the board could bring the vacancy rate down by the beginning of the next calendar year. The board's most recent hires are as follows. Kayla Surprenant was hired as a Staff Services Manager 1 in the Licensing and Examination Unit. She started with us on August 2nd, and I'm pleased to report that we were able to hire from within to fill behind Pahua Tao's position. Marilla Turan was promoted to an Associate Governmental Program Analyst in the Administrative Services Unit effective this past Monday. She previously served in the Licensing and Examination Unit and will be replacing Pahua. Board and council members will be working closely with Ms. Turan on board business, including travel and hotel arrangements for meetings, training, meeting attendance, and a host of additional administrative duties. The next item I'd like to report on is the Registered Dental Assistant in Extended Functions Examinations. As you all are aware, the board was suspended the Rdaef examinations in 2020 due to COVID. During the last 14 months, board staff have continued to reach out to dental schools in both North and South to reserve a location to administer the clinical and practical examinations, but were unsuccessful until June of this year, when the board was able to secure a contract with Arthur A. Dugoni School of Dentistry at the University of Pacific in San Francisco. The Rdaef clinical and practical examinations were administered by the board on July 31st, August 1st, August 14th, and August 15th in San Francisco. There were approximately 200 candidates in the queue for testing. All candidates were contacted and offered a space in those 2 examinations. On the first weekend, we tested 65 candidates. On the second weekend, which was just last weekend, we tested 26 candidates for a total of 91 candidates. Many candidates decided not to test at this time and opted to see what happens with Senate Bill 607. If the governor signs 607, it will go into effect January 1st of 2022, and RDAEF candidates for licensure will not be required to take a clinical and/or practical examination. I want to thank Tina Valerie, Chief of Licensing and Examinations, and her team for running these examinations. It's a huge effort on their behalf, with staff traveling to San Francisco, spending the night for the weekend, and conducting these examinations. So thanks to the team, you've done a great job. I'll next be reporting on the annual report that the Director of the Department of Consumer Affairs is required to submit annually to the Governor and the Legislature. This report includes information on the number and general patterns on consumer complaints and the action taken on those complaints. So the reporting, and so our board staff for the last 2 months have been working diligently to validate the numbers to ensure the data is as accurate as possible for the dental board. I want to thank the executive team of Sarah Wallace, Bernie Baba, Tina Valerie, and Carlos Alvarez spent many, many hours going through the data, ensuring that it is as accurate as possible. We will be reporting the average number of days from when a board receives a complaint until the board is assigned to an investigator, the average number of days from opening an investigation conducted by the staff to closing the investigation, regardless of the outcome, and the average number of days from closing an investigation to imposing formal discipline. All this information is quarterly reported by our staff in your quarterly board meeting materials. We have an exciting event coming up, subject matter expert training. The board is continuously working on improving the investigative processes within the enforcement program, with the emphasis on protection of the California consumer. The board's enforcement managers, along with the dental consultants, Dr. Paul Joe and Dr. Patrick Shank, have been working for over a year to develop the expert training guidelines and training. The new guidelines will allow a standardization in reviewing cases and a standardization in writing expert reports. The training is mandatory in order for current experts on the board to continue to review cases as subject matter experts. I am pleased to announce that 2 subject matter training sessions have been scheduled. The first on Wednesday, September 15th from 10:30 to noon, and the second will take place on Friday, October 1st from noon to 1:30. The role of the subject matter expert is extremely important in identifying deviations from the standard of practice by writing a detailed report describing the deviations from the standard of care, and by serving at an administrative hearing as a subject matter expert witness. The board has 81 experts on its list. All have responded and plan to attend the trainings. The training session will include some of the following topics. Of course, an overview of the expert's role, the new expert guidelines, expert report writing in the new format, a discussion on the standard of proof, defining clear and convincing evidence, also discussing conclusion categories, and things to do and not to do. We look forward to reporting at the November meeting on the success of this training. The next item I'd like to discuss is our strategic plan. Tricia St. Clair, the planning facility from Solid, has nearly completed the interviews with board and council members and managers. Thank you to those members who participated in this process. She will be analyzing the information obtained not only through the interviews, but the information obtained from the SurveyMonkey of stakeholders that was conducted in early June. This data will be used to assist the board in determining the strategic plan for the future. As you know, we had hoped to schedule an in-person meeting October 7th and 8th in Sacramento. However, due to a major concert in the Sacramento area, hotel accommodations were not available. After the board meeting, staff will survey members to determine another date for this planning session. I would like to notify you at this time that should we be able to meet in person before the end of the year, and if the meeting takes place in a state facility, that members who are considered state employees will be required to show proof of vaccination or a negative COVID test before participating in the meeting. I'll give you more information on that requirement as we get closer to nailing down an in-person date for the strategic plan. This requirement, I believe, will not be in place when we have our November meeting because we're having the meeting at a hotel and not a state building. So stay tuned, more will come. In late July, I was contacted by Rachel Cobbler, the Executive Director of Central Regional Dental Testing Services, otherwise known as credits. She was interested in discussing how to seek the board's acceptance of the credits dental examination as a pathway to licensure in California. As an aside, the Dental Hygiene Board accepts credits examination for licensure of dental hygienists in California. Sarah Wallace, Assistant Executive Officer, and I met virtually with Ms. Cobbler and Dr. Mark Edwards on Wednesday, August 4th to explain the process. That acceptance of a new exam not only requires a statutory change, but review by the Office of Professional Examination Services to determine compliance with state requirements for examinations. Ms. Cobbler and Dr. Edwards asked to be on the November meeting to present the credits examination. I have an update from Dr. Kevin Keating, the Dean of the California North State University College of Dental Medicine, which is located in Elk Grove, just outside of Sacramento. Dr. Keating notified me last week that he received initial notice from CODA that the California North State University College of Dental Medicine has been granted initial accreditation by CODA. According to the plan submitted to CODA for initial accreditation, the school anticipates admitting its first class in January of 2022, which will graduate in 2025 using an accelerated delivery of the 4-year curriculum. The second cohort of students will begin in July of 2022 and will graduate in 2026 with the standard delivery 4-year curriculum. Both models of delivery were evaluated by CODA to ensure the same curriculum is delivered in each model. Each class thereafter will be a 4-year class beginning in July of each year. Staff will be working with legal counsel and Dr. Keating to determine next steps. I just wanted to update you that we received notification that the department received a notice from the California Department of Social Services that it expects an increase in individuals coming to California with special immigrant visas over the next few weeks and months. Actually, this was anticipated prior to the emerging situation in Afghanistan, which may further increase the number of individuals coming to California in the future. I just wanted to let you know that there's statute that requires these applications to be expedited, and staff will be prepared to comply with this statute if these individuals apply for licensure, and we'll be providing an expedited application process. I'm just going to conclude my report by mentioning that the annual election of officers for the board will take place at the November 18-19th meeting, and those interested in running for the office of president, vice president, and secretary should notify me 30 days prior to the meeting of their interest in running. And Madam President, that concludes my report, and I'll ask the board members if they have any questions.
Thank you, Ms. Fisher. Are there any board member comments? Please use the raised hand feature. And I see Dr. Morrow has his hand raised. Dr. Morrow?
Thank you. Ms. Fisher, I had a question regarding the subject matter experts. What is the process for recruiting subject matter experts? And also, is this a paid service or is it a volunteer service?
I'm sorry for me coughing at this inopportune time. Carlos, would you like to jump in and answer this question for me? Carlos, are you able to respond?
Are you able to hear me? Hello?
We can hear you now.
Okay, great. Thank you. Sorry about that. To answer Dr. Morrow's question, the experts are paid for reviewing cases, and also for recruiting. What we do is in order to recruit, we either get a recommendation from an expert if they have a cohort who wish to be an expert, and we also reach out to dental schools, not dental schools, but the universities, to see if they have any experts that wish to be an expert with the dental board. So we send out notices and flyers as well if anybody wishes to be an expert.
Just another question, if I can. Is it within the scope for a dental board member to recruit subject matter experts?
Now, that's a good question. I'm not sure about that one. I'll kind of bounce back to Karen. I'm not sure about that one.
Sorry. I would say we can ask our legal counsel to perhaps weigh in on this, but if you, I don't think that there necessarily would be an issue with board members generally putting out the word that we're recruiting subject matter experts, and that they can contact the board for additional information. But we'll ask Tara if she agrees or disagrees with that.
This is Tara Welch, legal counsel. I agree with Ms. Fisher's statement that board members could direct potential expert candidates to the board and its website for additional information to apply for subject matter expert position.
Thank you very much. Appreciate it.
Any other board member comments? Dr. Loren?
Thank you. This is Dr. Nadine. I'm just sorry. Karen, could you please repeat the name of the school that's partial accredited, or I didn't hear that too well. This CODA approved.
Okay, so this is the new dental school that's located in Elk Grove, which is just outside of Sacramento. Dr. Kevin Keating is the dean of the California North State. Let me just check to see the exact name here. California North State University College of Dental Medicine.
Oh, okay. The one by Sacramento?
Yes.
Okay, okay,
Yeah.
Thank you.
It's a private university, and Dr. Keating at the May meeting, I believe, gave a presentation.
Okay, thank you. That's all.
Thank you, Dr. Loren. Any other board member comments? Seeing none, and Dr. Loren, if you could lower the raised hand feature. And I believe you just click on it. Thank you. Are there any public comments? DCA Moderator, please facilitate the lines for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on the presentation that was just made, please click on the Q&A icon on your screen, type comment into the text field, and submit that to the host. And seeing no requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Thank you. We will now move on to agenda item 6, report on Department of Consumer Affairs activities. I will ask Brianna Miller to present this agenda item.
Hello, good afternoon. Can you hear me all right?
We can.
Oh, wonderful. Okay, then I will get started. As I said, good afternoon, board president and board members. I'm Brianna Miller with Board and Bureau Relations at the Department of Consumer Affairs. Thank you for allowing me the opportunity to provide a departmental update. One of our top priorities in Board and Bureau Relations is appointments, and I would like to provide a brief overview. Currently, the board has one vacancy, a public member appointed by the governor, and 2 members in their grace periods. DCA and all the appointing authorities share the goal of a fully seated, diverse, and effective board. Filling current and upcoming vacancies is a priority. If any members know any great candidates, or if any members of the public are interested in serving, please find the link titled Board Member Resources on DCA's homepage to apply for appointment. Next, I'd like to discuss remote meetings. DCA is receiving many questions about when and how boards will meet again in person and whether they can also continue to meet remotely. As the law and executive orders stand today, after September 30th, all board and committees will be required to return to in-person meetings with publicly noticed meeting locations. However, due to ongoing changes in the COVID-19 pandemic, it may happen that the ability to meet remotely will be extended in some capacity. We do not have any concrete news today, so DCA will do all it can to assist boards and bureaus to plan safely for in-person meetings, and we will keep you informed of any changes to meeting requirements. Moving on to COVID-19 safety measures. To combat the spread of COVID-19 and protect vulnerable communities, California is implementing enhanced safety measures for state employees and workers in healthcare settings. State employees must show proof of vaccination or they will be subject to regular COVID-19 testing and will be required to wear appropriate PPE. As Executive Officer Fisher mentioned just a few moments ago, board members and committee members are considered employees and must follow these health and safety protocols if they plan to be physically present in a DCA location, whether it be for a board meeting or just even a quick visit. Members must verify vaccination or follow face coverings and testing protocols in accordance with that location's requirements. Statewide guidance for the use of face coverings from the California Department of Public Health remains in place unless the local health jurisdiction issues a stricter public health ordinance tailored for the situation in their communities. Many counties have revised health orders requiring face masks to be worn by both vaccinated and unvaccinated individuals while indoors. And as it pertains to healthcare settings, to further protect Californians and healthcare workers, the California Department of Public Health recently issued 2 public health orders. The first requires workers in healthcare settings to be fully vaccinated or receive their second dose by September 30th, 2021. The second public health order directs hospitals, skilled nursing facilities, and immediate care facilities to verify that visitors are fully vaccinated or have tested negative for COVID-19 in the prior 72 hours before indoor visits. Licensees are encouraged to thoroughly read the CDPH public health orders and regularly check their local public health department website for additional vaccination requirements. Questions from licensees about the healthcare worker requirements can be directed to the California Department of Public Health. And we know things are moving quickly and there's a lot of information, both official and unofficial. And so I encourage all members and the public to visit DCA's COVID-19 webpage for updates and resources to the state's reopening plan, public health guidance, vaccinator resources, vaccine distribution, and more. And next, I'd like to talk a little bit about DCA waivers. The full list of current waivers and guidance can be found on the DCA website. DCA is still awaiting final approval on the COVID-19 waiver transition plan for the waivers that have been issued and their status moving forward. DCA continues to encourage boards and bureaus to look at laws and regulations that were waived, determine if changes are needed in the future, and move forward with those changes. Although some waivers may extend an additional short amount of time, boards and bureaus should prepare accordingly as waivers will begin ending at some point. Boards are encouraged to move forward with statutory and regulatory changes as soon as possible to that end. And lastly, I'd like to provide a reminder about required board member trainings and the learning management system. As a reminder, 2021 is a mandatory sexual harassment prevention training year. This means that all employees and board members are required to complete the training during this year. Please also be advised that you will now access this training through the Learning Management System, or LMS for short, which is DCA's training portal. We have created profiles for each of you in the LMS and informed your executive officer of the steps you will need to take to log in and access the training. Board and Bureau Relations is also happy to assist you with any questions or concerns you may have about using LMS. Ultimately, the LMS will house your training records and may also be used to sign up for other mandatory trainings. And on that note, I'm happy to report that you can now register for the Board Member Orientation Training, or BMOT for short, through LMS. As a reminder, newly appointed and reappointed board members are required to attend BMOT within a year of appointment or reappointment. The final training of 2021 will be held via WebEx on October 13th. And as always, Board and Bureau Relations is here to help. And if there's anything we can do to assist you or your board, please reach out. And so that it concludes my presentation, and I will hand it back over to Board President Pacheco. Thank you.
Thank you, Ms. Miller. Are there any board member comments? Please use the raised hand feature. Seeing none, are there any public comments? DCA Moderator, please facilitate the lines for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to make a comment on this presentation, please click on the Q&A icon on your screen, type comment into the text box, and submit that to the host. Seeing no requests, would you like me to close the panel?
Yes, please.
It is closed.
Thank you. We will now move on to agenda item 7, budget report. I will ask staff to present this agenda item.
Good afternoon, board members. This is Wilbert Rumbawa, Administrative Services Manager. I will be presenting the budget report, which begins on page 24 of your meeting materials. The first section of the budget report is a summary of expenditures from July 1st, 2020 to May 31st, 2021. The dental board has spent approximately $13.4 million, or 76% of its total dentistry fund for fiscal year 2020 to 2021. Of that amount, approximately $7 million of the expenditures were for personnel services and $6.4 million were for operating equipment and expenses. For attachment 1, which begins on page 26 of your meeting materials, it displays a detailed breakdown of expenditures for the state dentistry fund by line item. For prior year and prior year actuals are displayed in the green columns. For current year budget and year-to-date expenditures are displayed in the blue columns, and the expense projections for year-end spending and the remaining balance are in the orange columns. Based on the reports received from the Department of Consumer Affairs, the board is expected to revert $2.6 million at the end of fiscal year 2021. On page 25 of your meeting materials, the Budget Act of 2021 was signed by Governor Gavin Newsom on July 13th, 2021. This law outlines the state's budget for July 1st, 2021 through June 30th, 2022. The fund condition statements for fiscal year 2021-22 were not yet available at the time of this memo, but the updated fund conditions will be provided at the next board meeting. The current appropriation for this year is $18,488,000 for the state dentistry fund. On page 27 of your meeting materials, this fund condition displays an analysis of the state dentistry fund. The board has sufficient funds in reserve for economic uncertainties and has historically reverted a significant amount of money at the end of each year. On page 28, This is a fund condition that displays an analysis of the state dental assisting fund condition. The state dental assisting fund condition merged with the state dentistry fund on July 1st, 2020. The reserve balance is kept in this state dental assistant fund for a period of time for up to 3 years to be able to pay any expenditures from previous years. After those years, the reserve balances will be transferred to the state dentistry fund and the state dental assistant fund will be abolished. There is no action items on this agenda item. This concludes the budget report, unless any board members have any questions.
Thank you, Mr. Ramboa. Are there any board member comments? Please use the raised hand feature. Dr. Felsenfeld.
Mr. Bauer, good afternoon, sir. I have a quick question, which may be simplistic, and it may be my ignorance of budgeting, but it's been my understanding that if a government agency does not use all of its budget, it gets cut in following years. You talked about a $2 million reversion, which I assume is overage, that we did not spend it this year because of various reasons, probably travel, but we did not spend $2 million. And yet the governor has given us about a 5% increase for next year. Is it likely that this will continue, that the budgeting will be appropriate for our activities, or that maybe this will be cut back based on the fact that we're not spending it all?
Good question, Dr. Felsenfeld. So at this time, expenditures and the appropriation is built each fiscal year based on all the budget drills that are distributed to state departments. So at this time, after reviewing our budget drills, it doesn't look like the budget appropriation will be reduced at this time. So I was going to report on this on the next meeting, but there are also loans that were distributed to the general fund loan, and there was also a control section loan that was distributed as well that was tied to the furloughs. But now that our furloughs have been restored, a portion of that loan amount, approximately $984,000, has been repaid to the state dentistry fund. And so, we're at the beginning of budget building again. So, as I stated before, our budget doesn't look like it's in jeopardy of being reduced at this time.
Thank you.
Thank you, Dr. Felsenfeld. Ms. McKenzie.
So I just had, it's not really a question, I guess maybe more it's a comment. So when I look at, like if we're looking at page 27 on the meeting materials, I see obviously over time, if you look at months in reserve, we are kind of going down pretty drastically. And I know in the past, that's actually been something that we had tried to increase so that we had a little bit more buffer for when things happen. So maybe it's just a comment to the board of something that we might want to think about in the future of whether there's an issue that we're getting down to only projected only 3.8 months in reserve.
Thank you, Ms. McKenzie. Dr. Laren.
Hi, thank you for your report. Yeah, I think you might have answered it already about the loan. There was a state loan taken from the dental fund, I believe. I think you said it was already repaid. Did we collect interest on that? Because I see interest from interfund loan. Does that have to do with that, or how much income, do we make any income from the loan, like interest income?
Hi, good afternoon, Dr. Ladine. So the general fund loan of $5 million has not been repaid, but the control section has been repaid, and that was for $984,000. But the $5 million loan is still outstanding. On the $5 million loan, there is an interest amount that's accrued, and that will be included in the interfund interest payments. I will have to get back and do some research. I'm not sure the exact percentage amounts, but I can get that. And for the 984, I will double check if that accrued interest. I can't for sure say if it has or not, but I'll get back to you for the next board meeting.
Okay, thank you. Yeah, I'm glad I pointed that out. I thought that $5 million loan was the one you were mentioning. I didn't know we had a separate loan. But that interest should be included on the revenue 4150500. Should it be included there? On the line item of revenue transfers and other adjustments, that interest, I think that's where it goes, right? Because I see $0 collected from interest.
Yes, so the books haven't closed yet for fiscal year 2020, 2021. So once it closes and the final amounts are set, the new fund condition will be updated.
Okay. So this is not monthly? This is not a monthly report? This is a yearly, annual?
Yes. So this was based off of the governor's budget for fiscal year 2020, 2021. So since we are currently in the Budget Act of 2021, that fund condition has been released as of the beginning of. At the time, it wasn't available, but the new fund conditions are out, and they will be provided at the next board meeting. So they are released every 6 months for the governor's budget, and then 6 months for the Budget Act.
Okay, just one last question. Thank you. When do we expect to get the loan repayment? The $5 million.
So the Director of Finance shall order the repayment of all or a portion of the loans if the Director determines that either the fund has a need for the money or there is no longer a need for the monies in the general fund, and the loan will be repaid with interest.
Okay, thank you very much.
Board members, this is Sarah Wallace, Assistant Executive Officer. I wanted to take a moment to address Board Member McKenzie's question about the funds in reserve. I wanted to let you know that we are closely working with the Department of Consumer Affairs Budget Office on monitoring our fund. As you'll see in the fund condition, in current year and budget year and moving forward, the budget is a projection that's always assuming that we've spent the full appropriation, which in years past has not necessarily been the case. So while the months in reserve are reducing significantly year over year, at this point, I don't foresee us having any financial issues at this point due to the reversion that we've historically had, the salary savings that we have, and the fact that we have the outstanding loan to the general fund. We are going to be meeting with the budget office and putting a plan of attack together here for the next several fiscal years just to monitor where we are going to be. And before we're able to increase fees, there are several steps that would need to be taken. One would be that the fund would have to be repaid from the general loan. We would have to do a fee study, and then there would have to be a regulatory process and determine whether or not statute would need to be amended. So we're a long ways off from that at this point. It is constantly being monitored, and we'll continue to update the board as we move along.
Thank you. That's helpful. And as I know, it does take a while if we did need to raise fees for that to occur. So it's good to know that you guys are actually looking at it now. Thank you.
Yes, thank you.
Thank you, Ms. Wallace. Are there any public comments? DCA Moderator, please facilitate the lines for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this report, please click on the Q&A icon on your screen, type comment into the text box, and submit that to the host. And seeing no requests, would you like me to close the panel?
Yes, please.
It is closed.
Thank you. We will now move on to agenda item 8, discussion and possible action regarding the American Dental Association Dental Licensure Objective Structured Clinical Examination DLOSCI as a pathway to licensure. I will ask Karen Fisher, Executive Officer of the Board, to present this agenda item.
Thank you, President Pacheco. As you recall, on May 13th, the Examination Committee met to consider whether or not to recommend that the board accept the ADLOSCI as a possible pathway to dental licensure in California. We had representatives from the Joint Commission on National Dental Examinations give a full overview of the examination. And ultimately, the committee reported back that they would like the board to consider accepting the ADLOSCI. Board members had the opportunity to respond to that report that was given on the second day of our May meeting on May 14th, and there were no additional comments or questions by board members at that time. So at this meeting, we are not looking at hearing about the DLOSCI again, other than staff recommends the board request OPES to review the ADLOSCI for compliance with California state examination requirements and to report back to the board at a future meeting. I anticipate that OPES will not only look at the DLOSCI, but might also report back to the board essentially how the DLOSCI format translates with the other formats of examinations that the board accepts, and we'll be asking the board to review all formats to see if somehow we can make a general standardized approach to examinations. So at this point, staff recommends that the board request OPES review the ADLOSCI for compliance with California state examination requirements and to report back to the board at a future meeting.
And I see 2 hands raised. The first one was Ms. Burton.
If this is an action to be moved, then I move the suggestion, but I'd also raise my hand in the hopes that before we started this, we could have 5 minutes. So if we could have 5 minutes after we finish this item, I'd appreciate it. And I move item 8.
Okay. Thank you, Ms. Burton. Dr. Felsenfeld?
I was going to move it, but I will be happy to second it.
Okay. Thank you. Okay, so we have a motion to accept the staff recommendation. The board requests OPES review the ADA DLOSCI for compliance with the California state examination requirements and report back to the board at a future meeting. Motion by Burton and seconded by Felsenfeld. Are there any public comments? DCA Moderator, please facilitate the lines for public comment.
This is the moderator. We've again opened the Q&A panel. If you'd like to comment on this item, please click on the Q&A icon on your screen, type comment into the text box, and submit that to the host. Our first comment comes from David Karsten. David, I've sent you a request to unmute your microphone, and as a reminder, you will have 2 minutes.
Thank you very much. I'm Dr. Dave Karsten, speaking on behalf of the JCNDE and the ADA, and I would like to thank the California Board for considering the DLOSCI for licensure. I know that incompetent people pass boards and competent people fail them, and that does not protect the public. And as a Washington State Dental Commissioner, I care deeply about that. I also care about fairness to both patients and students. As an attending in a general practice residency, I want to know that my new resident has clinical judgment and critical thinking that are essential in the treatment of very sick patients, protecting the vulnerable public. An exam that tests clinical judgment and critical thinking is what we need, what I want to protect the public. And if a practitioner has those skills, they self-correct. What are the missing pieces? Ethics and Hippocratic values. I hope that we can create a way to evaluate those before we train a healthcare practitioner. Those elements, along with critical thinking and clinical judgment, protect the public. Now, medicine, by the way, is attempting to do exactly that. So what about physical clinical skills? No one's supposed to graduate from a CODA-approved program without minimally competent skills. And I know the California board trusts CODA. We have good schools and CODA is robust. Besides that, if students have critical thinking and clinical judgment, they know how to correct those problems. If they are ethical and hold Hippocratic values, they will. The DLOSCI clearly tests clinical judgment and critical thinking. We designed it that way from the ground up based on experiences of all the rest of healthcare and what actually works to protect the public. And
30
I've been
seconds.
honored to be part of this and continue to participate. As of yesterday, I know from the most recent quality control panel that reviewed the exam that's coming up next, the finest, most sophisticated exam that we have ever produced was the result. I have met many of the exam constructors, and they are made up of a sampling of the smartest people in dentistry. Our testing professionals have collaborated with those dentists to produce a superb quality examination. The scientific analysis and validation results have been better than we hoped for. My
Time has
students,
expired.
thank you very much.
And seeing no additional requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Thank you. Board Secretary, please call the roll and record the votes for this agenda item.
The motion is to request OPS review of the ADA DLOSCI for compliance with California state examination requirements with a report back in a future meeting. Burton.
Aye.
Burton, aye. Chan.
Chan, aye.
Chan, aye. Felsenfeld, aye. Loreen.
Aye, Letty.
Loreen, aye. Honey, thank you. Mackenzie.
Mackenzie, yes.
Yes, Mackenzie. Medina.
Medina, I.
Medina, aye. Mendoza.
Mendoza, aye.
Mendoza, aye. Molina.
Molina, I.
Molina, aye. Montel.
Montel, I.
Montel, aye. Morrow.
Morrow, aye.
Morrow, aye. Olagi.
Malagi, I.
Olagi, aye. Pacheco.
Pacheco, aye.
Pacheco, aye. Stewart.
Stewart, aye.
Stewart, aye. You.
You, aye.
You, aye. The vote is unanimous. The motion is approved.
Thank you, Board Secretary. We did have a request for a 5-minute break. If we could at this time return back, could we extend that to just make it 3 o'clock?
You're the boss.
Okay, we'll come back at 3 o'clock. Thank you. Welcome back, everyone. We will now move on to agenda item 9, report regarding May 25th, 2021, California Department of Public Health statewide partnership for oral health meeting. I will ask Member Fran Burton to present this agenda item.
Thank you, Madam President. Members, particularly new members, it has been my pleasure to be the board's representative to the California Department of Public Health, the statewide partnership for oral health. So we had a meeting on May 25th, and it was a webinar with 3 objectives: to educate and inform about sugary beverage policy efforts, to understand the partnership role in supporting the California Oral Health Plan, and to identify opportunities to participate in partnership work groups. So the meeting was open with remarks by Dr. J. Kumar, who and these are his remarks, that this meeting came at a time when the shutdowns required by the pandemic were beginning to lift. The impact of COVID-19 led to exponential decay and lack of treatment and coverage for about 6 million families and children who lost their dental coverage. School programs weren't operational, and 2/3 of the funds spent by counties were more on police workforce than the health workforce. Going forward, in his words, it'll be important to focus on health equity and the future of school dental programs. The focus of this meeting was data sharing, information, and open communication. So since the last meeting, 12,000 children have been surveyed, and there is an overall decline in caries in third grade students. The number of dental sealants has been increased. The hope is that the recently enacted child tax credit will make a difference in policy for underage children. The rest of the meeting focused on sugary drinks. And there were some statistics about the number of children who consume sugary drinks in the course of a day. And there was a discussion about a choices project that the Department of Public Health is conducting. And the discussion there was about a sugary drink tax for California. And it was kind of noted that that is not something that we expect to see soon. After a lot of discussion, it was noted that the legislation that was passed in 2018 preempts local jurisdictions from passing any grocery taxes until 2030. So that pretty much means that there will be no sugary drink tax in the near future. Jared Fine then discussed a measure that Oakland has with its WIC program, where it is screening, doing some dental screening through the use of a hydration program in the Oakland schools, which turns out to be very, very successful. Beyond that, the partnership groups discuss updates on their activities, and there was an introduction of 3 new work groups. And at the end, CDA presented a policy update. So that was the meeting. Are there any questions? Or comments?
Thank you, Ms. Burton. Oh, and Dr. Molina, did you have a question?
Yes, I just wanted to comment that the legislation had passed to reduce the consumption of sugary drinks and sodas in the past. Is that why we see that decrease in the number of caries in third graders?
I would say not. When you think that 61% of children and 50% of adults consumed at least one sugary drink daily in the statistics going back to 2014. So what I would say is that we need a lot more work in this area.
Thank you.
Thank you, Dr. Molina. If you could lower your hand. Are there any other board member comments? Thank you, Ms. Burton.
I have my hand raised. I'm sorry. This is Dr. Stewart.
Oh, Dr. Stewart. Yes.
Thank you, Fran, for that report. I heard what I heard you say was that Jared Fine spoke about a dental screening, a program that was successful, something about dental screening, a hydration program. Could you expand on that just a little bit, please? Help me understand that.
The program is in Oakland, and it's based on a measure with an $11 million annual revenue, which was expanded through WIC, the WIC Oral Health Program. So $250,000 is used for this dental screening program. And what they have in the schools is hydration stations. And that's about all I can tell you about it.
Okay, thank you. Thank you very much.
Thank you, Ms. Burton. Any other board member comments? Seeing none, are there any public comments? DCA Moderator, please facilitate the lines for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this item, please click on the Q&A icon on your screen, type comment into the text box, and submit that to the host. And not seeing any requests for comment. Would you like me to close the panel?
Yes, please.
It is closed.
Thank you. And this concludes the open session portion of this meeting on Thursday, August the 19th, 2021. The board will now recess into closed session. At the conclusion of the closed session, the board will return to open session for the purpose of meeting adjournment. Due to technological limitations, adjournment will not be broadcast. This meeting is recessed until Friday, August 20th, 2021 at 9 a.m. Thank you, everyone.